In order to have any discussion about facelifts, types of facelifts, facial rejuvenation, all of this stuff, we have to start with facial anatomy. Therefore, we both get to have a little bit of a basic understanding of the vocabulary we're going to use so that we're all talking about the same thing. When we look at the face, your face is basically kind of like an onion. It has layers to it. We all see the top layer of the skin, and every woman on the planet goes in the mirror and says, all I want is this. However, I have to translate that into what surgical procedures are really going to achieve that result. So in order to do this, we need to kind of take a look at the anatomy of the face, okay? So when we look at the face, and if we had the opportunity to cut the face in cross-section and take a look at the cross-section, we have the skin. Underneath the skin is a very thin layer of fat. Actually, there really isn't a lot of fat there, but it's a very thin layer. Underneath that is something called the SMAS layer. The SMAS layer stands for the superficial musculo-aponeurotic system. It is basically a layer consists of muscle as well as a tough tissue. It envelopes the entire face. It goes from about right here all the way down into the collarbone neck region. In the neck, it's called the platysma, and you can see the results of that platysma when you do that kind of movement right there. Underneath that SMAS layer is the glandular layer right here, which is called the parotid gland. Underneath that is some of the deep muscles and other tissues of the face. In the neck, you have the platysma, which is connected to that SMAS. It's one of the same. Underneath that, you have additional glandular structures, nerves, arteries, and important stuff. So the same thing exists whether we're talking about the neck or the face. Skin, thin layer of fat, SMAS layer. Underneath that is a whole bunch of important stuff like the facial nerve, other nerves, arteries, and veins. A very important thing to understand is all of these tissues are actually anchored to the bone or the skull underneath. And they are anchored at very critical points. The first critical point is right here. This is the zygomatic ligament. The second critical point is right here. This is called the mandibular or mandibular osteocutaneous ligament. The third one is on the anterior surface or the frontal area of the masseter or the masseteric ligament. The fourth one is down in here where the platysma and the sternocleidomastoid muscle, or this thick muscle right here, connect. These four anchoring points are what hold all the tissues to the face. I hope this basic anatomy lesson has been useful to you, because this is something we're going to refer to in some of our future videos on facial aging and what actually happens to all of those structures.